Hi guys, thanks for tuning in to the Reid Health channel. It's great to have you here. Today I want to actually talk about the topic of really what is acupuncture. So many patients we get in the clinic will come in for a treatment and they'll go, so how does acupuncture work, or does it work? So obviously it's a question that's in a lot of people's minds, and maybe a lot of people want to actually try acupuncture, but they just don't know enough about it, or they don't know how it works. And let's face it, you don't really want to try something unless you know how it works. So let's give you a little bit of an idea, and I'll try and explain this as easily as possible, I suppose. There are a number of different explanations as to the theories of acupuncture. As you may or may not know, acupuncture has about a 2,000-year-old written history, but there is evidence to say it goes back as far as 5,000 years. Okay? And I suppose in those times, people started noticing that, when they had instances of injury or illness, then certain spots on their body became tender. For example, if they had something like a headache, then they might have been finding a tender spot on their leg, and by pressing into or rubbing that spot or massaging it or stimulating it with heat, then sometimes the headache went away or the symptoms were certainly alleviated. So this obviously drew a little bit of curiosity, if you like. So people started grouping the points together. So if I've got a headache, these points become tender. If I've got back pain, these other points become tender. Okay? If I've got pain in the ear or an earache, another set of points become tender. And by pressing into these points or rubbing them, we're able to alleviate those symptoms. And then they started fine-tuning this. And again, this is over hundreds of thousands of years. So fine-tuning, going back to that headache example, if I have an occipital headache, which is a headache at the back, there's a certain group of points which become tender. If I have a headache in a temporal region, the side of the head, there's another group of points. And if I have a headache at the front, in the frontal area, of course, a separate group of points become tender. So these points started being documented into groups with common characteristics. So these are the points I need to press to alleviate pain in this area of the body. Okay, so a little bit later on, and again when I say a little bit later, I'm talking hundreds of years, a new theory was brought about, but that all these points on the body were connected by lines called meridians. Okay, now you may have heard of acupuncture meridians before, and an acupuncture meridian, to compare it to Western science, an acupuncture meridian basically follows the main nerve pathway of the body. Okay? But in ancient Chinese medical theory, each meridian was connected to an organ, and there were 12 meridians connecting the 600 or over 600 acupuncture points on the body. Okay? For example, there was a meridian relating to the lungs, there was a gallbladder meridian, a stomach meridian, a spleen meridian, a liver, a kidney, a small intestine, a large intestine meridian. And they all connected to the organ, and they connected groups of points together. Okay? The theory is that energy, and you may have heard of the theory of qi. Okay, now if we want to combine, qi in Chinese medicine is a vital energy source, and that's what makes us do everything that we do. When we're excited, when we're pumped up, we've got a lot of qi. When we're tired, we're deficient in qi. If you'd like to compare the concept of qi to Western medicine, we might be talking about things like the energy produced in cells, or nerve activity, or even muscle power comes close to the concept of qi. So the theory is that qi and blood flow through these meridians and through the acupuncture points. And when the individual's in times of illness or sickness, it means the qi, or the energy in the blood, starts slowing down their flow in one of these meridians. For example, if someone has asthma, it may stand to reason that the lungs aren't feeding the lung meridian properly. So we start getting a slowing down of blood and energy in that meridian. An analogy I'll use here is if you liken that to a garden hose. Okay? Everyone's watered the garden before, haven't they? So if we take the hose as being the meridian, and the water flowing through the hose is like the energy in the blood flowing through the meridian, just say there was a time of illness or sickness in the body. We'll take the example of asthma, for example. You would get blockage in the lung meridian where qi and blood start to slow down its flow. So if you're watering the garden and you pull the hose and you get a kink in the hose, what happens? The water starts slowing down and pressure builds up, and not much is coming out the other end, is it? And that's really, to put it simply, very similar to the acupuncture theory. So with that example of asthma, when the lung energy is weak, it's not feeding the meridian properly, so the energy in blood starts to slow down its flow. It's like getting a series of kinks in the meridian, and those kinks happen at the acupuncture points. So as acupuncturists, by needling into those points, we're freeing up the flow of chi and blood, or energy in blood in that meridian, and restoring health to the lungs and to the whole body. Obviously, it's a matter of sitting the patient down and asking them a number of questions, and we might ask them about things like sleeping habits, bowel movements, energy levels, diet, any kind of pain they might have, and all of this information that the patient gives us will enable us to decide which acupuncture points we need to needle into with our very fine stainless steel needles, okay, to be able to rectify the flow of energy and blood in those meridians and restore health. As you may know, acupuncture can be fantastic for a number of conditions. Pain, any kind of neck pain and back pain, acupuncture really works very, very well for these conditions. Headache and migraine, but the full range of respiratory conditions as well, asthma, hay fever, shortness of breath, even snoring can work quite successfully with an acupuncture treatment. Okay. We also treat a lot of emotional disorders, anxiety, depression, those kind of problems. We treat fertility as well. So acupuncture is very effective at treating a lot of things that Western medicine can treat, but just in a more natural way. Okay. Please feel free to check out our website at www.reidhealth.com.au, or we'd love to answer any of your queries if you'd like to call the clinic on 9802 7000. That's with a 03 area code. Okay. Thanks for tuning in, guys, and we'll see you soon.